5 by 7. Okay. All right. Hello, my name is Kristen Mabey. I'm a family nurse practitioner student at the University of Texas in Arlington, and I'll be taking care of you today. Do you have any questions?
Nope.
No. But before we begin, I'm going to wash my hands. And I'll have a few questions for you. Can you tell me your name and your age?
My name's Doug, 36.
Okay. And can you tell me where you're at right now?
I'm at home.
Okay. And can you tell me today's date?
The 25th of October,
And what's the year?
2016.
Okay. And can you tell me your mood right now?
I'm good.
Good. Okay. So patient is awake, alert, and oriented to time, person, and place. He is dressed appropriately, maintains, communicates effectively, maintains eye contact, and reports his mood is good. Okay, so first we're going to start with the head. I'm going to visualize the hair, which looks evenly distributed. Okay, I'm going to palpate. Any tenderness?
Nope.
No tenderness noted to palpation of the scalp, and the hair is coarse brown with some grain going on. No lesions or masses noted, no erythema noted to the hair. So next I'm going to look at the facial features, which are symmetric. And next I'm going to look at the eye brows and the eyelashes, which appear to be symmetrical bilaterally and with no signs of infestation. So next I'm going to look into look at the eyes. Go ahead and keep your eyes open. I'm just going to pull down. Conjunctiva and lens are both clear, and the irises are brown. The pupils are round and equal. The sclera is white. Now I'm going to palpate over your eyes. If you just close your eyes for me. Is there any tenderness? Okay. Eyeballs are firm, no tenderness noted to palpation. Lacrimal apparatus is soft without any signs of erythema or exudate noted. Next, we're going to do the accommodation. So what I'll have you do is follow this as I move it in closer to you. Okay. Symmetrical bilaterally. Next, we're going to do the corneal light reflex. So what I'll have you do is look at my nose, okay, and shine the light in between your eyes. Corneal light reflex noted bilaterally. Next, we're going to do the cover and uncover test. So what I'll have you do is cover one eye and look into the distance. Okay. No deviations noted. We're going to do direct and consensual. Okay, so I'll shine a light, look in the distance. Actually, look at me. Pupils are equal and round, reactive to light, equal bilaterally. Next, we're going to do the visual acuity. So the Snellen chart we will not do today, but I'm going to tell you about it. It tests the distance vision acuity. It will be placed 20 feet away from you. You'll be asked to cover one eye. You'll read the lowest line that you can see, and the lowest line that you get all correct would be your visual acuity for that eye. Then you would repeat and do the other eye. But for now, we're going to do the Rosenbaum, which is near vision. So I'll have you hold it about 14 inches away from your head, your face, and read, the lowest line possible.
428739.
Okay, 20/20 to the left.
428739.
Okay, and 20/20 to the right. Pupils are 2 millimeters equal and bilaterally. So next we're going to inspect inside the eye. You turn it on. Okay. First, we're going to do right eye to right eye, and we're going to look for the red reflex. Okay. Red reflex is noted. We're going to move in. The optic disc is round with well-defined edges. Blood vessels are noted without hemorrhage. So we're going to do the left eye. First, looking for the red reflex. Red reflex is noted. We're going to brace and come in, and the optic disc is round with well-defined margins. The blood vessels were noted without hemorrhage. Okay, so next we are going to do the ears. I'm going to inspect the pinnas. The pinnas are in line with the eye canthus and symmetrical bilaterally. And we're going to palpate the penis and the lobe and the mastoid process. Did you feel any tenderness? Okay, no tenderness noted to the pinna, the lobe, and the mastoid process. No lesions or nodules noted. Next, we're going to look inside the ear, I'm sorry. First, looking at the external canal. No drainage, no erythema, no foreign body noted. Okay. Tympanic membrane is visualized. Pearly gray in color. Landmarks of the umbus, the umbo, the handle of malleus, and the cone of light. And then to the left ear. Look at the external canal. No cerumen, no foreign body, no masses or lesions or drainage noted. Look inside. Tympanic membrane visualized. It's pearly gray in color. Landmarks are noted, including the umbo, handle of malleus, and the cone of light. So next we'll do the whisper test. Let me shake my mouse. The whisper test. So what we'll do, Doug, is I'll speak 2 words behind your ear, behind you, and you just repeat after me. Okay? Can you cover your left ear?
French fry. Popcorn.
Okay. And the other side.
French fry. Popcorn.
Okay. Doug was able to verbalize both words on the whisper test without any difficulties. Okay, so next I'm going to do the nose. The nose is midline. You could hold one nostril and inhale. Okay. Another one. Okay. Bilateral nares are patent. I'm going to palpate the nose. Any tenderness? No. No nodules or masses noted to the nose. I'm going to change out the speculum on my otoscope. Okay, I'm going to look inside the nose. I'm going to brace. Septum is midline. Terminates are pink and moist. Bilaterally. Okay, so next we're going to do the sinuses. I'm going to palpate the frontal and the maxillary. Let me know if there's any tenderness. Any tenderness? No tenderness to the frontal sinuses. Any tenderness? No tenderness noted to the maxillary sinuses. So now I'm going to do the maxillary sinus transillumination, which would be done with the lights out and pin light placed on the maxillary sinuses. Open the mouth. Okay. No occlusions noted to other one to the maxillary sinuses. Okay, next I am going to inspect the lips. The lips are pink and symmetrical with no lesions noted. Then we'll look into the mouth. So what I'll have you do is open your mouth for me. Okay, tongue is pink and moist and symmetrical in midline. Buccal mucosa is pink and moist. Typically I would be able to palpate the teeth, count the teeth. There are 32 teeth noted. Lift your tongue. The frenulum is symmetrical with no lesions noted. So typically I would use a tongue depressor, but he has a really bad gag reflex. So we won't do that, but I need you to open your mouth and say ah.
Ah.
Okay, the uvula rises in his midline. The tonsils are 1+, and the pharynx is pink. Okay, so next we'll do the lymph nodes, and we'll start in the occipital. Preauricular, postauricular, submandibular, submental, posterior cervical, anterior cervical, and if you could scrunch your shoulders, supraclavicular. You can raise your arm up for me. Axillary, and epitrochular. Was any of that tender? Yeah. Lymph nodes palpated and non-tender. Lymph nodes non-palpable and non-tender. So next we will do the neck. We're inspecting for thyroid megaly. No thyroid megaly noted or pulsations. I'm going to palpate the trachea. Okay. Trachea is midline. I'm going to palpate the carotid. Okay. Carotids are strong bilaterally. Now we're going to auscultate for bruise in the thyroid and the carotid. Using the belt. No bruise noted to the carotid and thyroid. Next, we're going to check the thyroid. So what I'll have you do is take a sip of water, hold it there until I tell you to swallow. Swallow. Okay. One more time. And swallow. Okay. The thyroid cartilage is smooth, non-palpable, no masses or lesions noted. So I want to step back for just a minute and check the Weber test, which is for unilateral hearing loss. So what I'll do, Doug, is put this on the top of your head. Let me know if you hear it better on one side or the other, or if they're the same. Okay, great. No unilateral hearing loss noted. Next, we're going to do the Rhine, which is air conduction and bone conduction. So I'm going to place this behind your ear. Let me know when you no longer hear it. And then again, on the side of your ear, let me know when you don't hear it. Same thing on this side. All right. Air conduction to bone conduction is 2-to-1 ratio. So now I'm going to take a break for a second and look over my notes, make sure I covered everything on this part. Okay, so we're going to do extraocular movements of the eyes. So what I'll have you do is I'll ask you to follow with just your eyes, not your head. Okay? No nystagmus noted. Okay, so now I'd like you to take off your shirt. Okay, I'm observing the chest. The chest is symmetrical. Respirations are even and unlabored. Noting the skin and the fine black hair noted to the anterior chest. We count respirations. Respirations are 18. So next I would, I'm going to percuss the chest. Resonance heard to the anterior portion of the chest. Again to the back posterior. You can raise your arms up for me. Timpani heard, or I'm sorry, resonance heard anterior and posterior chest. Now I'm going to auscultate the lungs, starting with the trachea, listening for bronchial sounds. Okay. Expiration is greater than inspiration. Expiration is equal to inspiration. Now we'll do the periphery, listening for vesicular sounds. Okay. Choose my arms up for me. And we'll listen to the posterior. Two more times. Vesicular breath sounds are equal and clear by anterior and posterior. So next we're going to move on to the heart. I don't see any pulsations noted. I'm going to palpate the precordium. Okay. No thrills are noted. Next I'm going to auscultate with both the diaphragm and the bell. The diaphragm listens for high-pitched sounds, and the bell we listen for low-pitched sounds. So I'll alternate in between each point. Starting with the diaphragm to the right second intercostal space. Just wait normal for me. And then again with the bell. This is the aortic. Okay. Pulmonic is left second intercostal space, left sternal border. And the third intercostal space is the Erb's point, left sternal border. And then also with the bell. Fourth intercostal space is the tricuspid, the left sternal border. And then again with the bell. Fifth intercostal space, mid-clavicular line, is the mitral. Listen first with the diaphragm. This is also the apical. And that you would listen for 1 full minute. So I would listen for 1 full minute, and apical pulse is 80. Pulses are strong and equal bilaterally with no murmurs or splitting noted. So next I'm going to assess the blood vessels, starting with the temple. Brachial. Radial. Dorsalis pedis. And posterior tibialis. And also, again, the carotids. Pulses are 2+ and strong, equal bilaterally. Next I'm going to assess the capillary refill to the upper extremities. Capillary refill to the upper extremities are less than 2 seconds. Now the lower extremities. Capillary refill to the lower extremities are less than 2 seconds. Skin turgor is rapid recoil. So now I'm just assessing the overall skin. The skin is appropriate to ethnicity. There is some hypopigmentation patches to the upper extremities, and darker on the forearms than the chest. Tattoos on both arms. No ears pierced. No ear piercings or anything like that. So we're gonna look at the nails. Should we compare them go out? And look at the nails. They adhere firmly to the nail bed. They're pink, they're short, well groomed, and no lesions noted. Same with these nails. And the toes. You can put your thumbs together like this. Okay. No clubbing noted. Adhere at 160 degrees. So next we are going to go on to the abdomen. Okay. Actually, yes. Yeah. So I'm inspecting the abdomen, and there's fine black hair noted to the around the umbilicus area. Some striae noted around this side. And we're going to auscultate the bowel sounds. Bowel sounds active, times 4 quadrants in the epigastric region. Next we're going to, I'm going to percuss. I'm just going to tap on your belly. Tympani noted times 4 quadrants in the epigastric region. Next we're going to percuss for the liver span, to measure the liver span. We'll start at the umbilicus, listening for dullness. I'm going to measure. Now, 7 centimeters, liver span is 7 centimeters, normal is 6 to 12. Next we're going to percuss for the spleen, listening for dullness. Dullness noted in between the 6th and 10th intercostal space. Next we're going to palpate the abdomen. First lightly palpating. Let me know if there's any discomfort. Any tenderness? No tenderness with light palpation. Deep palpation? No tenderness? No tenderness noted upon deep palpation times 4 quadrants. Next we'll do the Murphy sign, which is the right upper quadrant. So what I'll do is I'll press down. I want you to take a deep breath, okay? Deep breath. Okay. Any pain? No? And Murphy's sign is negative. Next we will do the I'll have you stand up. Actually, you can put your shirt back on now, if you'd like. Sorry. just stand here for me. I'm checking his posture. His posture is erect. And if you could put your feet together for me, we're checking the Romberg. Close your eyes for me, hands to your side. Balance is steady, with no swaying or loss of balance noted. So if you could walk for me just across here. Okay. Steady gait noted. Next, I'll have you, if you could bend over and touch your toes. So turn around this way, sorry. Checking the spine, the curvature of the spine, no masses or lesions noted. That's good, you can stand up. No lateral curvature of the spine. Next, we'll check the hips. Scapula, so can you put your arms back for me just a little bit? Okay. And relax. And shoulders, scapula, and hips are even and symmetrical, so that's a negative on the scoliosis. Okay. So one more stop. You can go ahead and sit down. Look at my notes one more time. Okay, and so I want to check for CVA tenderness. So I'm going to tap you on the back. Any tenderness there? With the ulnar side of my hand. No tenderness? Okay, no tenderness noted. Okay, so we're going to do range of motion of the cervical. So I'll have you flex your neck down and extend. And hyperextend, okay? And we'll rotate to the side, and rotate to the other side. And ear to, there you go, and the other side. Okay, full passive range of motion to the cervical. I'm going to do passive. Move down, extend, hyperextend, okay. Rotate, rotate. Full passive range of motion to the cervical. Next, we'll do the shoulders. You raise your arms up over your head, okay, and behind, and cross in front. Any pain or tenderness there? No. So passive, active range of motion is noted to with no full range of motion to the shoulders. Now I'm going to do it for you. Okay, raise your arms up and back, and cross in front. Okay, and full range of motion, both active and passive, to the shoulders. Next, we'll do the elbows. And have you, active, so I'll have you flex, and extend, and turn in, and turn out. Okay, and this arm as well. Flex, extend, turn in, and turn out. Okay, and now I'm going to do it for you. I'm going to flex, and extend, turn in, and turn out. Okay. Flex, extend, turn in, turn out. Good. Both active and passive range of motion to the elbows. Full. Okay. Next, we're going to do the elbows. I'm sorry, not the elbows. The wrist. I'll have you flex your wrist and extend and turn out, which is abduction. Turn in, adduction. Okay, so now I'm going to do it for you. Flex, extend, abduction, abduction. Flex, extend, abduction, abduction. Full range of motion, both passive and active, to the wrist. Next, I'm going to do the fingers. So I'll have you clench your fist. That's a flex. And now we're going to extend, fingers in, adduction, abduction. Okay, now I'm going to do it for you. I'm going to flex and extend, abduction and adduction. Flex, and extend, abduction, and adduction. Fingers, full range of motion, both active and passive. Okay, so next we'll do the ankles. I'll have you plantar flexion up and dorsiflexion down, and abduction in, abduction out. Okay, now I will do it for you. Plantar flexion, dorsiflexion, adduction, abduction. Okay. Plantar flexion, dorsiflexion, adduction, abduction. Full range of motion, active and passive to the ankles. Next, we're going to do the, actually I'd like for you to lay down. We're going to do the plantar reflex, which will be done with our reflex hammer. Okay. What I'll do is I'll swipe this across your foot, okay? Negative intensity. So next we'll do range of motion of the knees. What we do is bend this knee for me and extend. And same with this knee. Any pain? No pain noted. Now I'm going to do a passive flexion and extension. Flexion and extension. And both active and passive range of motion is full to bilateral knees. Next we'll do the hips. I'll have you flex again each knee. Okay, and come on down. One more time. Back up. Okay, and rotate in and rotate out. Any pain? Sorry if you do that. Rotate out and in. And you'll flex out. External rotation. And then this one I want you to do by yourself. I kind of helped you on the last one. So flexion, internal rotation, external rotation. Okay. And so hips are have full range of motion, both bilaterally, both active and passive. You can go ahead and add under stomach just real quick. I'll do the tendons.
Oh, this is so soft.
I know, I'm sorry. Okay, so we're going to do the Achilles deep tendon reflex. Okay. 2+ on the deep tendon reflex to the Achilles. And can I get you on your back one more time? I'm going to do the drawer test. Step back just a little bit, and we're going to do drawer test. So go ahead and bend this knee for me. Down. Drawer test is negative. Okay, now you can sit up. We'll continue on with the deep tendon reflexes. Okay, so we're going to do the brachial radial. Relax here. Measure that. Relax. All right, and now we'll do the bisect. Relax this arm here. Okay, and then the triceps. So I'll have you make an L, make this little wobble, and bear all your weight on my arm. go. So all the deep tendon reflexes are 2 plus, and one more, and you're going to do the knees. But so far, 2 plus on the deep tendon reflexes. Relax the knee. Relax. All right, patellar deep tendon reflex is also 2 plus. Okay, so next we're going to move on to the cranial nerves. Starting with cranial nerve number 2. Cranial nerve number 2 is sensory. It is intact as evidenced by, cranial nerve 2 is optic, sensory, and it's intact as evidenced by 20/20 vision, bilateral eyes. Cranial nerve 5 is the trigeminal, which is sensory and motor. So what I'll have you do is clench your teeth. Okay. No carpus noted. So I will also do facial sensation for cranial nerve, the trigeminal. So I'm going to orient you to sharp, soft, and dull. Okay? So this is sharp, dull, and soft. Okay? Can you close your eyes for me?
Sharp. Dull. Soft.
Okay. That is correct. Cranial nerve 5, trigeminal, is intact. Also, as evidenced by the no carpus, and the he was able to verbalize each sensation to the face. And cranial nerve number 7 is the facial nerve. It is motor and sensory as well. Can you tell me the difference between sweet and salty? Yes. Okay. And make a few faces for me. I want you to raise your eyebrows, and I want you to smile, and I want you to whistle, and I want you to puff out your cheeks. Okay. Cranial nerve 7 is intact. Next is the 7 and 8 is the acoustic. It is sensory, as evidenced by the whisper test, him being able to the popcorn and French fry. So that is intact. Cranial nerve 9 is the 9 and 10 is the glossopharyngeal and the vagus, which are sensory and motor. What I'll have you do is actually, can you differentiate between sour and bitter? Yes. And also he was able to swallow during the thyroid test, so therefore cranial nerve 9 and 10 are both intact. Cranial nerve 11 is the spinal accessory. That is a motor only. And what I would like you to do is push your chin down and your head back. Face me. Okay. And head down and down. Okay. Cranial nerve 11, the spinal accessory, is intact. Lastly is the cranial nerve 12, which is the hypoglossal. So I'll have you stick out your tongue for me and raise it up to your nose and to your chin, and then against your cheek, and then here. Okay. Cranial nerve 12 is the hypoglossal. It is a motor and it is intact. We're going to do coordination. And so what I'll have you do is put your hands on your lap, and with your eyes closed, I want you to alternate your hand from your the palm of your hand to the surface of your hand, and just rotate it. Okay? Keep going. Go ahead and go faster for me. Okay. Okay, that's good. Rapid movements are he was able to perform without any difficulty. Next, I will do the finger to nose check. So if you could just put your finger on your nose and out, and finger to nose and out, and then alternate. With your eyes closed, sorry. And can you go faster for me? Okay. Coordination is intact. So lastly is the sensory, which is will be superficial and vibration. So I'll do the sharp, the dull, and the soft. So let me just reorient you again. Sharp, dull, and soft. Okay. So if you could just close your eyes and tell me which area you feel it at and what you feel.
Soft on my left forearm. Dull on my right arm. Sharp on my right forearm.
Okay. And then doing the lower. Go ahead and cross your feet. Eyes closed.
Sharp on my left lower leg. Soft on my right lower leg. Soft on my left leg. Dull on my left leg.
There we go. Okay. Last is the vibrations. So I'm going to tap this to one upper extremity on the bony province and on lower bony province. So if you could close your eyes for me and tell me where you feel it.
Left elbow. Right ankle.
Okay. I'm going to check my notes one more time. I know I'll get a point off, but I just want to cover, make sure that I did everything. Just one more thing, I just want to make sure I verbalize that when I auscultated the heart and all the aortic, pulmonic, urge, tricuspid, and the mitral, that there were no murmurs or splitting noted. And that is it.